The following podcast is brought to you by Kidney Stone Prevention Clinic of Orlando. Dr. Paul, could you tell us what your business is, please?
Yes, our business is kidney stone prevention. So with patients that have passed several kidney stones, we evaluate them to find out what are their metabolic reasons that they continue to produce stones, so we can intervene and stop the process from happening over and over again.
Yeah, that sounds like a good idea. And Dr. Paul, what is one of the most fundamental pieces of advice you can give to patients who continue to pass kidney stones?
So the first and foremost thing, Will, is that patients need to take in adequate fluid.
What does that mean, adequate fluid intake?
Right. So yes, to quantify it, it's 2.5 liters per day, 80 ounces per day of fluid. Because the more fluid you have, the more dilute that the urine is, and the less likely it's going to be saturated and make stones. So that's, if you have a golden yellow urine, you haven't had enough fluid since the last time you've gone to the bathroom. So you need to take in more fluid.
You're not golden, right?
Correct. That's not a good thing to be. You want to be clear.
Hey, for those of us who are, a little illiterate in fluid ounces, can you give us like how many cups or quarts or anything like that we could break it down to?
Absolutely. So, the standard water bottle that we all drink these days is 500 milliliters. So it's 5 of those per day, that amount of fluid. And you want to space it out through 24 hours. So what I tell patients is have one with each meal, have one in the evening before you go to bed. You're going to have to get up to use the bathroom in the middle of the night, and have one at your bedside table, and take in another one as much as you can in the middle of the night. And that'll get you through 24 hours to get 2.5 liters. And again, the goal is, if you haven't had anything from supper till breakfast and you wake up and you have a golden urine, that's when patients are making stones, is overnight when they're concentrating their urine. So that's what you're trying to avoid.
Okay. Well, that's good advice. It's kind of like an old warrior trick too, right? They used to drink a lot of water before they went to sleep so they could get up earlier to either raid the camp or be ready to be raided. So good advice for everyday life. So we're talking about good fluids, right? Which is water. Anything else would you consider a good fluid?
Yeah. So pretty much anything is okay. And water's, of course, the best standard, but it doesn't have to just be water. There are studies that show if patients take in more than 5 cups of coffee per day, they'll actually have less stones, or 5 cups of tea. Believe it or not, there's less stones.
That's counterintuitive, right? Because kidney, you're thinking it's a dehydrating agent, but wow, that's good to know. Then that is really good.
And same thing with alcohol, beer, less stones, wine, no problem. So the only fluids that you want to avoid.
That's my next question. What should you avoid?
Yeah. So a couple things that I've seen. One is, for whatever reason, grapefruit juice. So the other juices are good. In fact, the citrus juices are good. Citrus juices are good because they have citrate in them, which is a stone prevention agent. But for whatever reason, grapefruit juice doesn't fall in that category. The other thing to avoid is beverages that have high fructose corn syrup in them. For whatever reason, that makes more stones as well. The other thing that I've seen is people will drink Gatorade, and when they take in sodium, it winds up causing more calcium in the urine, and that can sometimes cause stones. So that's something you want to take in cautiously. I had a patient that worked outside in the heat in Florida, so he drank a lot of Gatorade, and his urine calcium was quite high.
Ooh. For those that, high fructose corn syrup, right? Maybe some people know that, some people don't know. What's a good example of a drink that has high fructose?
So basically soda, Coca-Cola. I mean, I don't want to pick on any specific brand, but that's where you usually see it. Or, even like High C and that sort of stuff that's processed. Yeah. So again, you're better off with water or like,
Yes.
even like I said, coffee or tea, that sort of stuff
Right.
is
Just
okay. And just
anything
like I
but
said,
a Hawaiian punch, right? How'd you like a nice Hawaiian punch, right? That
right? Fruit juicy, no thanks.
yeah,
Yeah,
I don't want a physical Hawaiian punch or a drink that's a Hawaiian punch. Okay, so there's some clarity right there. Avoid high fructose corn syrup and grapefruit juice, but you can drink the other citrus juice, right? Would be squeezed lemon and water or orange juice, but not grapefruit juice. So that's really
absolutely.
good advice. Let's be clear about that. And um, why I guess why does kidney stone prevention why is it such a passion of yours? I mean, this is the driving force in your medical service to the community. So why did that ring out of all the, treatments and all the medical avenues you could go down? Why is this one your passion, your purpose on the earth?
Well, a few things. I've, we treat a lot of very sick people, and that can get difficult over time. The nice thing about kidney stones is they're very preventable, and patients that have had multiple kidney stones, they're very motivated to get worked up, and then they're also equally motivated to follow through with treatment. And it's a very objective thing. It's something that's very measurable. And then I can show them, here's why you're making stones. And the light bulb goes off, and we start them on treatment, and they stop passing stones. And they are so grateful. I have a friend for life when that happens. So I find it very rewarding.
Yeah, you truly are making a difference in people's life. It's kind of as obvious as scary and painful ordeal. And this is a great service. Dr. Paul, can you let's paint a picture of a patient that you've treated that has a diet that a lot of us have because of the Western diet, especially the American diet, that's high in sodium. Can
Mhm.
you give us kind of a patient, what they were eating? They came and saw you, and they're making stones again, and they're confused. Could you run us through a little bit about a patient who has a high in sodium diet, and just go through the beginning and the process of working with you?
Yeah, this was a young lady. She was in college
Mm.
and had passed a couple of stones and came to see me. And when we did the evaluation, uh, she was taking in somewhere around 10 grams of sodium a day. Where, for example, somebody with heart failure, where you're trying to restrict their sodium, usually taking about 3 grams. And as a result, her urine calcium was very high. And I asked her, I said, do you use a lot of salt? And she said, oh, I salt everything. I salt pizza.
Oh my God.
And right. And so I said, well, if you moderate your intake of salt, that very well may be uh, all you need to stop making stones. And sure enough, when we rechecked her and she was good about eliminating salt in her diet, she did a good job, and her urine calcium normalized, and she never made another stone. So it was that easy with her. I didn't even have to give her any medication, anything different other than salt restrictor.
Uh, that's amazing. I know you probably talked to some people about it, and some people know more, a little bit more than others. Hey, we're all in different stages. So, could you give a quick talk about what's a good starter point for folks to get on a low sodium diet? What's a good game plan?
Well, I think it's hard to achieve because I do this
Sure
in patients
is.
that I treat with high blood pressure.
Yeah.
What what um, one of our mentors for high blood pressure, Norman Kaplan, what he says is if you read the label and there's more than 100 milligrams of sodium per serving, don't put it in your mouth.
Don't.
And that's his
Okay.
recommendation. So that definitely works. But like I said, it's hard to do because salt is in everything. Even if you don't salt the food, it's already been put in there
Big time.
with
Yeah.
even like simple things like salad dressing or condiments, or
Mm.
if you have one can of V8, it's got like 2 grams of sodium in it. So that sort of thing. And it's just ubiquitous in our diet. So, but again, if you're eating whole foods, fruits and vegetables, that sort of stuff, then you're in more control of what you're having because it's not processed.
Stay away from stay on the outside aisles of the grocery store, right? Don't walk on the inside.
Ideally, yeah. If it comes in a colored package where they're trying to attract your brain to it, then probably should avoid it.
It's hard though because they're trying to attract you, so it's a double whammy in difficulty.
Yes.
All right, well, yeah, that sounds like really good advice. I was even thinking in the back of my mind, if you do have, there's a lot of issues like high blood pressure, CHF, many diseases, you have to cut down on the salt. Get the fruits and vegetables, and maybe even work with a nutrition expert who can help you navigate, surviving in the Western American diet with the high sodium intake that we all take. Dr. Paul, you gave me some interesting stats about why people are making stones, right? And one of them is, you were talking about association with diabetes, right? Which increases the prevalence of stones. Why is that?
Nobody is quite sure, but it probably has something to do with urine pH and affecting it. And the issue is that diabetes is increasing in prevalence.
Yes.
So we're actually seeing more stones as well as a result of the higher diabetic population that we're treating. But nobody's quite exactly sure how that correlates. But again, treating your diabetes is good for multiple reasons, including stones. So,
yeah, they go hand in hand, and it almost sounds like a modern phenomena with the stones coming. So, Dr. Paul, you told me roughly 10% of the population is dealing with this or will deal with this.
Yes, and so in the United States, about 10% of the population, a little more common in men, a little more common as we age, and they're geographically, for whatever reason, it seems to be more prevalent in Southeast United States. It's called the Stone Belt. And the thinking is maybe because it's warmer climate and patients are concentrating their urine more. So nobody's, again, quite sure why it tends to be in that geographic region. And then about half the people that have one kidney stone will at some point in time have another stone. And about after 3 years, maybe 25%, 5 years, 33%, 10 years,
Wow.
half of them.
Wow.
And then the people that have a family history of stones also have an increased risk for making stones.
That is really something to think about. So, if somebody's listening to this podcast and they know someone who's dealing with this, or they are themselves, or they know they're at risk for this, we were talking about, a good idea is number one, the first thing you should do, right, is make sure you have adequate fluid intake, right?
Correct.
Which you said was 2.5 liters a day. And then what should you avoid, Dr. Paul?
High fructose corn syrup and grapefruit juice and high sodium beverages.
Good news, though. The stuff that's okay kind of blew my mind. Right? Coffee's okay. Beer's okay. I wrote this down in big letters. Wine's okay, too. I imagine, though, in reasonable quantities, right?
You want to moderate that for other reasons, health reasons. But from a kidney stone standpoint, no increased risk.
Oh, Dr. Paul, this was a great conversation today, right? We talked about what you should do, what you shouldn't do. We learned a lot about how sodium affects. Well, it affects everything, but it will definitely affect producing stones and other aspects of your health. So, Dr. Paul, awesome to have you on the show. Thank you so much. And
thank you, Will, for having me.
Until next time, thank you. Thank you, Dr. Paul, for joining us. Once again, you can reach Dr. Paul with any questions at www.kspfla.com or at 239-221-1281, the Kidney Stone Prevention Clinic of Orlando. Until next time, folks.